Imagine stepping outside and a gentle wind causing so much pain you could hardly bear it, or the kiss of your granddaughter was just too painful. That was one woman's nightmare for 3 long years, until a new, rare procedure at Wellmont Bristol Regional gave her her life back.
I couldn't do my housework. I didn't want to go anywhere. I didn't want to do anything. I didn't want to talk to anybody because just to talk could just set off that pain.
Elizabeth Taylor was living a nightmare and she was keeping it a secret.
I didn't want to tell anybody because, I thought, well, maybe it'll get better.
But it wasn't getting better. Elizabeth was suffering from a disorder called trigeminal neuralgia. It's a disorder characterized by repeated episodes of severe facial pain. Everyday activities could send piercing pain through the nerves in her face.
I couldn't brush my teeth. Like to put my makeup on, I would actually cry to try to put my makeup on. I felt just like about half of a person because I couldn't function.
Elizabeth also couldn't be helped. After finally sharing her debilitating experience with her family, doctors gave her medication that should have helped the pain, but Elizabeth couldn't tolerate the medication.
To go to a restaurant and sit down to eat and to see your mother open her mouth to take a bite of food and then just cry because the pain was so bad. And then to see her lose weight because she couldn't eat. It was devastating. And to know that you couldn't help her.
But that didn't keep her family from trying. Elizabeth's husband, Ira, was on the internet every night looking for some treatment that might help his wife.
I got on there and I knew if there was some type of cure or something that could be done for trigeminal neuralgia, that I should be able to find it.
Ira found the Gamma knife, which uses focused beams of radiation at the trigeminal nerve. But the nearest Gamma knife was in Winston-Salem, North Carolina. The Taylors set an appointment. That is, until Ira's coworker knew a little bit more.
And, he says, you don't have to go over there. He says, they do that in Bristol.
But it wasn't the Gamma knife in Bristol. It was better.
I was shocked and thrilled to death. I couldn't wait to get up there because I had such hope. And when I went, they immediately told me they thought they could help me.
This was hope. It really was. After all these years of seeing her in the shape that she was in.
That hope came in a revolutionary new piece of equipment called the CyberKnife. Wellmont Bristol Regional Medical Center is proud to be one of just an elite few to offer the CyberKnife. The CyberKnife's robotic arm allows superior reach and greatly expanded maneuverability. Multiple beams of high-energy radiation are directed precisely at the tumor or lesion inside the body. It delivers a concentrated dose of radiation to the tumor while avoiding damage to surrounding healthy tissue. The CyberKnife's pinpoint accuracy allows surgeons to reach tumors that previously would have been dangerous or even impossible to treat.
There's really not anything else in the field of radiation therapy that approaches the versatility and accuracy of the CyberKnife.
One of the reasons we're very excited about the CyberKnife is the precision of the dose. It conforms very tightly to the tumor, thus sparing the normal tissue nearby, much better than any other standard radiation therapy system. This allows the patient to recover quickly. All our patients come in as outpatients and go home that very same day without any significant toxicity.
The CyberKnife is the only stereotactic radiosurgery instrument with true image guidance monitoring. This unique system utilizes the skeletal structure of the body or implanted markers as a reference without the use of an invasive frame. A pair of X-ray image detectors positioned on either side of the patient's head continually tracks the target location, enabling the robot to correct for patient movement.
We track before each treatment's given, so therefore we don't require an invasive frame to hold the patient perfectly still. We are able to track if there is any movement occurring during the patient's treatment. We pick that up in the CyberKnife system, then deliver the dose to the patient, keeping in mind that the patient may have moved.
By integrating these technologies, the CyberKnife reduces patient trauma and improves quality of life before, during, and after treatment. Patients can have their scans days before treatment and need not to be present for the treatment planning process. CyberKnife treatments do not require an incision, anesthesia, or an invasive frame. With no recovery time, patients can return home the same day and immediately resume normal activity.
After they did the procedure, they said, "You ready to go home?" I felt nothing. And so my husband and I went out and ate breakfast.
She said that they gave her life back to her. Well, they gave me my wife back, and the kids their mother back.